Hi, I'm Gary Knoll. I'd like to welcome you to our program. Each week at this time, we're here to share information on how to improve the quality of your life. We deal with health issues, of course, and frequently I'm in the studio, but also I go out on the road. And for the next 4 weeks, I'm going to be on the road talking about something that affects everyone watching right now, and that's stress. You're going to see so many different natural ways of dealing with stress. Things you've never heard of, but they're available, and they're available probably right where you live. Join us now as we take you on the road and show you how to deal with a major problem in America, stress.
In our culture, we do not have any reason to feel exhausted at the end of the day. Driving a car, riding the elevator, sitting at a desk, the most physically active thing we might do during the day is to pick up the telephone. So why is it that we come home at the end of the day feeling exhausted?
Most people in our fast-paced society today meet many stresses. It can be very stressful even driving down the highway or coming and going to work, and in our relationships and our work environments. And we have a tendency to meet those on anxiety level. In fact, it's telling the body that we need to react in a way that's at a higher level.
When a stressful event happens to us, either to myself or to you, one of the things that I notice is that people are very much focused on what happened on the event. And as you and I know, that a person's response to the stress is very individual. Different people will have different reactions to the identical event. And not only that, but when something happens to you or to myself, our reaction may be very, very different at different times to the identical event.
Stress by itself is not a bad thing at all. In fact, the whole universe manifests because of a cosmic stress. We reproduce through a medium of stress. We live life through a medium of stress. So stress is very joyful. When we put stress on our bodies, we develop the muscles. We put a stress in sports. We enjoy. It is the excess stress that the body cannot handle, which is what causes the problems.
As a stress management consultant, which really consists in my case of being a psychotherapist and an acupuncturist, I'm always dealing with the interplay of mind and body. One of the good things that is happening finally these days is that Western medicine is recognizing the relationship between the mind, the emotions, and the body, and the way they are constantly interacting. Perhaps they're beginning to recognize that each is itself a biological phenomenon. And you can't possibly have emotions without there being a physiological basis and effect to those emotions, as well as even the subtlety of thought. And that thought is influencing the health and well-being, as well as any kind of pathology that a person may be experiencing.
Our internal response can be divided into 3 different areas. One is our thinking or our internal dialogue about what happened, about the event. And we'll do thinking about that. We may even do talking about that. That's one. The second is our emotions. So we may get angry, we may have anxiety, we may be fearful, we may experience rejection, and that's the second part. And the third part is actual physical reactions that you feel in the body, such as perspiring, such as tight muscles in the shoulders, butterflies in the stomach.
There are many kinds of stress. There's psychological stress, emotional stress, mental stress, and most probably damaging is physical stress, which comes from the others and ends up being lodged in places in your body.
What happens with stress is the body develops adhesions or contractions of muscle fibers or areas of limitation. And what I do is I feel with my hands and I see and get a quality from their emotional tone what is going on with that person. And then I address that. I have two areas. I look in the macro level, in other words, how they are in the world, and then I look in the micro level, which is how they are in the tissue and how the cell seems to fit. And it sounds a little abstruse, but in effect, it's a very kinesthetic feeling and sensation and feedback that I get when I'm working with somebody. With some people, they have too low a muscle tone and would like to lift it. Some people are too high and they make things stressful, or they register stress in their body by overreacting. She's more on the overreacting side, so we get her to relax some more. And I'll ask you to stand. And one of the things I'd like to do is to have you walk towards and stand on my platform where I can literally see the symmetry of your body. And just standing here now, we can see that she tends to over-tighten in her legs and tends to be a little tight in her shoulders and neck, and her head's a little bit forward. So these are all things we would work with. Stress contributes to this because her natural alignment is responding by tightening to what she perceives in her environment. Looking at Adela standing in the spinal analyzer, we can see the level of her shoulders, the level of her hips, the level of her knees, and how her feet are. And we can see whether one side is elevated or depressed, or if she has a slight rotation. And Adela has a beautiful body, as you can see. She's really very well aligned. One shoulder's a little bit higher. I would say that as far as the shaping of her body, her lower half tends to have more definition than her upper half. That gives us some indications. And her head is slightly forward of her shoulders, so that also gives us some information. And that just gives me a general idea. I can take a photograph and really know specifically before and after treatment what changes have been made. So I would take a photograph of her in this position and before the treatment, and then after the treatment she could actually see the changes that her body has undergone. What we're doing here is using landmarks to guide us in that expression. And this doesn't at all express her totality as a person, but it gives us a structural measurement, and that's helpful for the time being. So I'll have her lie on the table, and I can actually feel what's going on in the tissues, on the tissue level, and then we can take it into the more movement, a bigger movement area, so that when she's moving, she'll feel her body more connected. Looking at Adela lying down, I see certain things I'll point out to you. First of all, she has a really well-aligned body in general. I can tell that the right leg turns out a little bit more, her right foot turns out. She has one shoulder a little bit higher in this position, and I can see how she's breathing, and I can see her general demeanor, a feeling. I get a feeling of warmth from her. These all give me indications of how I'd like to work with her. So my hands are telling me to go to her back and her neck, so I think I will sit and begin. And you don't have to do anything, just drop down, let your chest down. You want to let this sink. So you don't need to help me. I'll just ask you to breathe. That's wonderful. Now I could feel her tone, what I call the idling speed of her muscle, just drop. So she's able to relax completely. That is really important for de-stressing. If you're not able to let go of your tension, you are going to have a tight and energy-tight body, meaning the energy is going to be tied into your body and tied up in your body. So to relax is of critical importance for de-stressing you. Do you work at a computer, or do you do things on the telephone? Do you use your head in a certain way on a daily basis?
Yeah, I work on the computer.
You work on a computer?
Mm-hmm.
So one of the things I would work with Adela is to make sure her station at the computer is set up ergonomically. In other words, that her hands are at 90 degrees to her elbows, that the computer screen is directly in front of her eyes and not lower than her eyes or not higher than her eyes, that she's sitting at 90 degrees, her hips are at 90 degrees to her spine, her legs are at 90 degrees to her hips, and her feet are at 90 degrees bent, and her feet are flat on the floor. So now I'm just going to lay her head on my fingertips, and I feel that she has pain. I can tell you. Does it hurt you?
Yeah.
Because I felt an increase in tension in her neck as I was putting my fingers under her head. So I'm just going to rest with her, let her lie here with her head on my fingers, and notice how her breathing is affected, if at all. And I can tell that her head is pulled to the left, so it gives me an idea that there's some torquing on the left side. And I'm going to go in with about 15 pounds of pressure. And I know it's painful. Is it painful?
Yes.
So painful for her. So I like to work towards the edge of the pain. The body is able to respond better when it feels an excess of pressure by sending a message neurologically to the muscle to say, let's let go of that area. That's why I'm interested in neuromuscular therapy, which is how I think of my work, because I'm interested in the nerves, how they affect the muscles, and how the whole system works as a unit, as an organism, how we function as a whole.
So thank you very much. I feel much better now.
What feels different? What feels different?
It feels, I had some kind of spasm here around my neck. Now I just feel much more comfortable, with all the movements. Really, it feels so good. If I wanted just to describe it in one word, it's fabulous.
Chiropractic is a method where we can detect various distortions in the muscle system and in the spinal column that might be causing pressure on a nerve. And the resultant pressure many times can make the patient very uncomfortable physically, and after the physical symptoms have been around for a while, emotionally. As you can see from this spinal model over here on the desk, when there is pressure on a nerve and the nerve is pinched, then the nerve cannot function well. This causes stress in the body. This causes initially physical stress. And once the physical stress overwhelms the body, then many times the patient will have mental stress. Going back to this young woman on the table, her right shoulder appears to be a little bit higher than her left. This happens many times when people go into the fight or flight posture. What happens in that position is the neck will be moved forward and the shoulders will hunch, similar to a cat arching its back. And then what will happen is this area will fill up with a great deal of tension. This is when you notice somebody who is not breathing properly and has a shortness of breath and is breathing usually from the upper body instead of from the diaphragm. This is called shallow, anxious breathing. When people breathe this way, this ultimately leads to a decrease in oxygen uptake and various types of anxiety disorders. This is why chiropractic works so wonderful when the mid-back, the dorsal spine is adjusted. The usual sensation immediately after the dorsal adjustment is given is the diaphragm is released, the nerves from the upper back flow freely into the lungs, and then the person usually notices they breathe better. And obviously, once you breathe better, much stress is relieved in the body because the oxygen uptake is much easier. And as you know, the central nervous system, being composed of the brain and the spinal cord, is the master system. And if there is any delay in the message from the brain through the rest of the body, stress will ensue somewhere. So for argument's sake, if the top bone, the atlas, is a little bit to the left or to the right, and the way we detect this is by gentle palpation, and we could sense which way it is, left or right. And if it is to the left or to the right, a little bit, and the cord is being pressed because the cord comes out from the top bone, then the messages will not be transmitted properly. There will be physical stress somewhere in the system, either with a headache, neck pain, or possible other symptoms, and then the resultant emotional tension and stress also. And this is why chiropractic works so wonderfully without any drugs or surgery. With the laying on of my hands, we gently adjust the spine and remove the nerve pressure like so. When we adjust the atlas, there are several methods. There are non-force techniques and more forceful techniques depending on what the patient needs. And we adjust that gently, and we remove the subluxation or the pinched nerve. Chiropractics use the word subluxation for a pinched nerve, and what that means is that the nerve pressure is not working at 100%. So it's similar to a light bulb that's on a dimmer switch. If you turn the dimmer halfway down and the light does not burn as bright, that is similar to what a subluxation is. The person's nerve energy is not at 100%, so it's at 50%. And whenever you don't have the body's nervous system, the brain and spinal cord, functioning at 100%, stress can result somewhere in the body. So many times I see people come in with a short leg, with their back up or arched, and sometimes with their head tilted to the left or to the right. And from reading this body language, we can determine that there is stress in their musculature and their spinal system. And by adjusting that, then that resultant stress will come out, and then the body will function better, and then the person will feel better emotionally as well as physically.
As humans, and humans being in a physical body, our bodies will communicate with us, particularly in areas of stress or tension. What we want to learn how to do is to listen to our bodies and to listen to what our body's communicating to us. As a massage therapist and body worker, I teach people how to listen to their body, how to move with their bodies, and how to be comfortable and present in their bodies. In this Western society, we tend to be very mental, and when we ask someone, how are you feeling, they may respond with, I think I feel, which is an indication that they're actually in their head as opposed to their body. And what we're wanting to do is to teach people how to be more comfortable in their body, how to eliminate stress, and this is done primarily by first identifying the stress and where it comes from, how it comes into our lives, and then we can release it once we've learned how to. It's not always appropriate for us to receive a massage in certain settings. If you're in the office or if you're in a grocery store and you may have a little tinge or want to have a little bit of relief, there are techniques that can be used for doing a self-massage in the office or in a setting. There are also techniques for working with others. If you're in an office situation and one of your co-workers is experiencing a headache or some stress in the shoulders, there's some quick little strokes that can be done to help alleviate any pain or discomfort.
Massage therapy is one of the best forms of stress reduction. And it's also one of the best forms of pain relief without using drugs or painkillers. When people come home from work and they have a really tense day, they can have someone work on their neck for them or their feet.
It just helps to alleviate tension. A really good way to help someone relax is to work on some points on their face and their head. And it opens up a lot of energy channels. It also helps to decrease some of the frown lines and wrinkles. So, you want to come underneath their brows and press up. And move your fingers in little circular motions. Does that hurt?
Not really.
Sometimes if you have congestion or sinus problems, this might hurt a little bit.
To the right a little bit.
But this opens up a lot of passages. Right in the temples. You want to hold that spot. Along the bridge of the nose, this opens up sinuses. And work around and up. And on the forehead, do some nice long strokes. Doing a 10-minute head and face massage will help relax, decrease tension, take away a lot of stress, and just, in general, help a person's overall health.
Aromatherapy is the use of the essential oils of plants, depending upon where they're created, the roots, the leaves, the flowers. They have medicinal purposes as well as therapeutic purposes. And the essential oil is what we call like the life force of the plant. It's that which makes it unique. Stress conditions such as anxiety, hypertension, depression can be assisted through aromatherapy. If you wanted to assist stress, a perfect oil that you could use would be lavender. Lavender is what we call the universal essential oil. You could use it in a number of ways. You could use it in your bath. You would put it with a bath and shower gel. Essential oils are not water soluble, so you would want to put it with a bath and shower gel. You could use it in a diffuser and actually put the essence into the air and create an ambiance for stress relaxation. You could also use it through massage. You could put it on your body with a carrier oil, and that's how you would do that. So with a panic attack, you could use lavender. You could use the Lang Lang again as well. Another essential oil that's very good for that sort of thing would be neroli. Neroli is from the orange blossom, and it's very good for panic attacks. A person who we would call a workaholic, who has very difficult time relaxing, would come home, and the best way that they could use essential oil initially to help in that stress management would be with a diffuser, to actually have his atmosphere when they come into the home be one of relaxation. The next thing that we would recommend is taking a bath and actually using the Lang Lang, the clary sage, the lavender for relaxation to really calm himself down or herself down. Now, other essential oils that you could use would be essential oils from the conifer family, which are actually uplifting essential oils like fir or spruce, which actually release and help to release some of the tension that one would have. And you would use that also in the diffuser or in the bath. Okay, so for a person who has stress and holds this stress, say in the back of their neck or in their shoulders, what we could use is some lavender, some marjoram, and what we would do is massage again the temples, massage the forehead, as well as we would massage the back of the neck. And you can do this yourself. It just feels, really put some pressure back there, massaging. The essential oils will go right into the skin. and we smell them. That's how the essential oils work, as well as going right into the skin and the muscles to help relax them. You could then massage your shoulders, and just really smelling the essential oils is going to give you a sense of relaxation. The essential oils work with the olfactory system, so just by smelling it, it's going to create a sense of relaxation and calm. How's that feel? Is that great?
Yep.
Okay.
Part of any stress management program has to be an exercise program. A lot of people think that they can diet alone and lose weight. A lot of people think they can meditate by itself and just be de-stressed. Well, you can to a degree, but you don't get to the higher levels. And when you start incorporating a regular daily exercise program, at least 45 minutes aerobically, you'll find that it changes the endorphin level in the brain. It calms you down. It makes you feel more at ease the whole day. And that's why people get used to exercise, find that, especially aerobic exercise, find that they're less stressed, far less stressed.
I recently started exercising on a regular basis, and that has de-stressed me not just mentally, but physically. I'm not tight in the joints anymore, lower backache is gone, tightness in my shoulders and neck, all of that stuff is gone because I've been exercising. I've been walking 3 miles every morning, and it sets me up for the rest of the day.
What I've found out that works very, very well is a ton of walking. So what I do is I walk about 7 miles a day. Actually, I walk for 3 days, take a day off, then walk for 3 days. I walk for at least 6 or 7 miles, sometimes 8 miles or even more. And I just feel so much better, less stressful. I just have a really terrific feeling after I finish the walking.
A lot of times you're under stress because of how you feel. You wake up in the morning, you look in the mirror, and you see thighs you don't like. You see a belly hanging over there. You see flab all over the arms, the back, the neck. You see the double and triple and quadruple chins. You see the puffiness in the face. You see bags under the eyes. You have the postnasal drip. Now, some of this is due to allergies. A lot of it's due to an overall deficiency in the immune system, laziness, overeating, whatever it has been you've done that has caused this. There's a very simple way of reversing it.
Power walking has changed my entire life. It started 12 years ago when I was in terrible pain with my sciatic nerve. I also had a very stressful life through my business. I was literally living in Alka-Seltzer every day. I found that walking released all my nerves. I also found that in about 12 or 13 years that I've been doing, I really haven't gotten sick once. I fight all my problems. I go out, I meditate, and my walking. If you're nervous, if you're depressed, if you have any kind of a feeling that makes you off balance, just go for a walk. We have done that naturally for so many times. How many times have we gone take a walk at the beach, in the park? It's a meditation form.
Well, there you have it. So many ways of dealing with stress. Join us next week when we continue our odyssey of dealing with stress naturally. I'm Gary Null. Thank you very much for watching.